Hello, everyone. Thanks very much for joining. In terms of the purpose of today, we are hosting one of our regular series of webinars, and we'll take you through the content. And obviously, as always, there'll be a great opportunity at the end for questions. Before we dive into it, I'll introduce myself. So I'm Tim Barclay. I'm the CEO of Appello. I've been here for 3.5 years, had that privilege, and it's been an absolutely tremendous roller coaster time for us, particularly these last 6 months, which have been quite a learning experience for the whole sector. And I think that comes out quite clearly, actually, in some of the findings from the report that we wrote. We'll cover more of that in a moment or two. Mark, do you want to introduce yourself?
Hi, I'm Mark Stratford, and I'm the Commercial Director for Appello.
Hi, I'm Ian Hockings. I'm Head of Marketing at Appello. I'll be monitoring the Q&A session, so please use the Q&A button at the bottom of your screen to ask any questions throughout the presentation. Great stuff.
Okay, so I'll share my screen and we'll have a run through a small slide deck. We'll try and keep this conversational because this is very much about making sure that there's value, information and learnings that you can take away from the time you're investing in us today. This is the report that we published at the beginning of August. I think it is now. The time flies when you're in COVID. It's about some of the learnings from a survey which was undertaken in conjunction between Appello and the Housing Lin into attitudes and perceptions and how those had changed amongst housing providers. And we were delighted that there were over 120 senior housing professionals who responded, and combined with the experience of all of that knowledge, plus our own learnings and observations, there were quite a few takeaways that were important. We've categorized them in this report and in 2 following reports into various areas. What we're focusing on today is about some of the learnings relating to Telecare. There are other learnings about housing provider resident experience and use of services, which will be in subsequent reports, the latest of which actually was published a couple of days ago. More of that in another time, though. For now, just a short introduction to ourselves and to the Housing Lin. You may be aware of both organizations, you may be aware of one of the other of us, but for the avoidance of doubt, from an Appello point of view, we're a 30-plus-year-old business. We are the market leader in 2 important areas of technology-enabled care services. Firstly, we run the largest digital TECS monitoring center, and by digital we mean receiving end-to-end digital calls. We've taken several million of those over the course of the last 1.5 years, and again that is a significant volume more than anybody else has taken in an end-to-end digital environment. It's given us a lot of learnings about digital telecare, and has also been driven by the fact that the second area we are the market leader in is in the provision of digital emergency call systems. So being able to provide a really improved living experience for residents. It's not just a beige plastic box on the wall, but it is actually a variant of a modern touchscreen enabled, video enabled device that provides a video door entry, apartment to apartment calling, a lot of the social functions that people have taken for granted in other sectors of the market, which perhaps has been excluded from the elderly and the vulnerable for far too long. Our partner in the survey was the Housing Lin, which is a sophisticated network of housing, health and social care bodies and entities. And the purpose of the Housing Lin is all about championing education, driving opportunity. They run a tremendous program of events, publications, collaborations, which if you're not already a subscriber to, then you should definitely seek it out. We've found a great deal of insight that they've shared during, under all circumstances, but particularly during the last 6 months, has been really helpful in understanding what best practice looks like across a number of different views of our market. In terms of the biggest of the learnings, we categorize them into 4 from the survey we did. And we're going to step through each of those 4 learnings with a little bit of an overview from myself and comments from Mark. And in particular, we were delighted that in advance we asked people to register questions and thoughts and topics that they wanted us to provide insights into, and we will cover those in each of these 4 areas. So one of the first areas of learning that there was a great deal of feedback about, with, as an example, the box in the middle, 82% of respondents said they felt enabling residents to communicate with friends, carers, family is an essential or high priority. So something that has always been inherent, but has been challenging, more challenging to do during these last 6 months, has gone up the priority stack. And we've certainly seen a very notable increase in the amount of utilization of video for communication. So we saw a near doubling on across our Smart Living Solutions estate in the amount of residents who were contacting other residents, or residents who were contacting an off-site house manager, or a house manager who was off-site but contacting a resident via video to be able to check in on their well-being and their capabilities. So I think that certainly is one of the things that that the survey made very clear, and that's driven by factors which are widely known in our industry. Loneliness and social isolation are not new challenges. COVID-19 has just exacerbated those. Technology has not been widely used historically, but the survey tells us is going to be used increasingly to help improve those loneliness and social isolation challenges. And I think in general, almost all of us found that video was a part of how, in our work lives and our home lives, we managed to stay in touch. I know I'm not alone certainly in the early days of lockdown, participating in Zoom drinks, Zoom quizzes, Teams meetings. Microsoft Teams video meetings are now an absolute staple of how we run our business, as well as how many of us run our social lives. Some of the questions that came up are on the right-hand side of the screen here, and we've in each example, we'll always try and give some flavour of our perspective on these. So, Mark, you're an industry veteran. You've been in the Telecare and TECS environment for 20 plus years. He says, being slightly kind. Well,
very
one of the questions that the audience posed in advance: what role can technology play in improving communication in supported housing? It'd be interesting to get your views.
Yeah, I think there's a wide range of possibilities. You know, to be fair, the technology's been available for quite some time in terms of sensors, in terms of video and different triggers. I think that the difference now in supported housing is going to be the appetite to engage with those technologies and understand how those technologies will provide support for the residents.
The next question kind of builds on that, which there was a query regarding what part suppliers play in ensuring competency, and I guess the point was in terms of competency with any type of technology that's deployed, and in the move to digital telecare, how important is advocacy?
Yeah, I think there's probably 2 parts to this. So if we talk about competency, I think there's 2 bits. There's Competency in terms of demonstrating the amount of satisfied customers. So if you look at Appello products, we've got about 10,000 people using digital technology. But the other piece to make the difference is to make that technology easy to engage with. So delivering good training, understanding the benefits to the person of the technology that you're delivering. For example, taking somebody that's got an analog door entry system where they might have a bit of poor speech coming through, they can't really hear who's at the door, there's background noise, and so people just don't use it. And we know that from the amount of door entry calls that come through to monitoring centres. So if you migrate that person to a video door entry system, where from the comfort of their own chair, they can see who's at the door, got really clear, loud speech, then people are much more likely to be able to use it if they've been trained on it and if they understand it. And the second piece, talking about advocacy, it's hugely important, and it's important at all levels. So right from the CEO and the board level to say, we need to embrace this technology, right across the spectrum to operational and delivery teams, so that they understand it too. They've had the training and they understand the benefit that it delivers to the people that need to consume the technology.
I think you touched on the key point there, which is if there's going to be advocacy, it's because there's going to be benefit, and that benefit has to be felt by the resident, by the housing provider, by the housing provider's employees. It has to be a virtuous circle. So I think you absolutely hit the nail on the head with that. The last of the questions that was posed in this area by the attendees in advance was, how can we create opt-in, opt-out fluidity at individual resident level? So I guess this is about how do you make it not one size fits all?
Yeah, and that's about the flexibility of the system, and that's the beauty of deploying digital systems, because they can be flexible and they can be remotely flexible too. And what I mean by that is allowing on-site staff to manage and change the functionality of the system, and allowing them to do things like customize the user interface, so that if a resident just wants one simple button, that we can do that. But what COVID's shown us is we don't always have people on site. So having that ability to do that remotely as well. So again, it's about the training, the understanding of the staff, and delivering that flexibility from, regardless of geographical location.
Very good. Okay. So if you were somebody who posed one of those questions and we either answered it or didn't answer it the way you wanted, or if you've got build-on questions on any of those points or around this wider topic or area, that would be great. We've just put a polling question up, which hopefully will give some useful insights that we'll share as we go through as well. So if I move on to the next slide, or to the next theme area, one of the second biggest, I guess, takeaways from the survey responses was about remote working. And some of this is kind of no surprise whatsoever, but it's also winding the clock back, very much a surprise in that if we were hosting this in January of this year, remote working would not have been one of the topics that would have been tabled, and yet it's very clear from the responses of the survey that this is something that housing providers now believe will be a part and parcel of how they operate, not just in COVID times, but in more normalized time as well. It was one of the top priorities that of the 120 respondents, the majority picked in the category of what major changes do you see coming out of your organization as a result of COVID. It's a trend that was already happening gradually within most work environments, not necessarily housing so much, but nonetheless, many organizations were increasing the amount of flexibility they offered their employees. COVID has put that on steroids, as we all know, as we all experienced at some stage or to some degree. In doing so, it's been apparent, and the survey findings reinforced this within the housing sector, that there had been agility benefits as well as resilience and employee well-being benefits. Monitoring centres, ourselves included, have experienced that as well. We had at one stage probably only 20% of our operators working from an office, and 80+% of them working remotely on secure devices in a cloud-based environment, still handling calls, but with all of the data held in the cloud, not on their personal device, so that there was no security risks. And I think what it's been very clear from the survey responses is that, as has been widely experienced across most businesses in the UK, there is going to be a need to understand how the flexibility that employees want to experience and the quality of service that residents still want to receive can be squared off. It was interesting to see that 80% or so of respondents felt that video communication will be an important part of how they deliver that type of balance of looking after their employees, well-being, flexible working requests, and at the same time delivering great experience for customers. The questions that were posed in advance on this section: why is it important that housing staff can access and manage data remotely? Mark, I think that's a pretty clear slam dunk, isn't it?
Absolutely, and it's about the ability to deliver the same service to the person irrespective of location. And it's about giving managers the ability to load balance work between people and teams now. Typically, if somebody's on holiday, people are making arrangements for another person to be on site. Well, that's not quite the case now. If we can access and manage data remotely, we can still deliver services remotely. And the other piece for me, I think, is data accuracy is absolutely paramount in our world. And ensuring that life-saving resident data can be updated instantly in the event of any change from wherever by the right person with the right ability and equipment to do so is a huge change for us.
Yeah, and when we're talking about the right equipment, we're talking about a web, in our case certainly, a web-based application, the single best record, which means resident data can be uploaded into the monitoring centre's files by somebody with the right security accreditation instantly. No sending emails, waiting for data to be uploaded. All of that creates not only, the question is, why is it important? As Mark said, it's all about that safety, that life of limb, and that certainty that data is in the right hands and securely providing the most up-to-date information possible. And in terms of the second question that was posed, so how can suppliers support housing providers to implement working from home? Should data be made readily available? I think we've probably partially answered that with the first question that was posed, but thoughts on that?
Yeah, I think you're absolutely right, and it's about investing in cloud-based platforms. So it's suppliers having not just a cloud-based platform for the accessibility, but a cloud-based platform with interoperability at the core. It's great being able to access these services. What's better is to be able to access the services through a familiar interface. So if it's an interface I'm used to, so you mentioned the SBR interface, which is used quite universally across our customer base, so being able to access those other cloud-based services through the one interface. I think that's the really important piece. And the second piece, should data be made readily available? Absolutely, but as you've already mentioned, in a secure environment with the right privileges, and things like data centers in the UK, things like making sure that data is not retained on a local device, making sure that privileges are very tightly controlled, and that all comes as kind of standard really with a cloud-based deployment.
And I think a sub point to this is that how can suppliers support housing providers? By making it simple. All of those things you described, they are highly technical, they are complex, they require investment and expertise. Those are things which suppliers can and should take care of and make almost invisible to housing providers behind a resilient, easy to use, robust and scalable system. So I think it's about that blend of doing all of the hard technical stuff behind the scenes, but providing the confidence that it's a easy to use capability. And if we're to, well, I don't think there is any doubt, but as a sector, as we embark more on this move towards flexible working, there's a question here which plays into the practicalities of that. What might a blend of face-to-face video calling with residents look like? What flexibility and productivity benefits might this create for staff?
Again, there's a multitude of answers here, but we're talking about flexible working patterns. So maybe staff having face-to-face video calling from a remote location 3 times a week, and then a face-to-face meeting 2 or 3 times a week. Again, it allows workloads to be distributed across different teams and different skill levels for different staff as well. So it doesn't mean that one person has to deliver everything now. It means that the right person with the right skill can deliver the right service. And then we talk about, things like less traveling. So we spend more time delivering the services and less time actually getting somewhere to deliver the services. And then very simple features like, and I'm okay. So if a person doesn't want to call, they're happy, we can just touch one button, again, on a familiar, simple interface, which allows the caregiver to say, right, I don't need to speak to that person today. Frees up the time where they can deliver the service to somebody who needs it more.
And I think those productivity benefits translate into, for example, individual house managers being able to look after multiple sites with a similar level of workload, rather than having to maybe look after a smaller number or only a single site, because they are permanently having to up and down the stairs, round the flats, round the apartments. Doesn't mean that's not important. That's absolutely important. But is that 5 days a week? Is that 4 days a week? Is that 3 days? There's an opportunity to create efficiency by using technology to bridge some of the gap. I'll take that as being a great point to move on to the third of our 4 learnings. Again, if those were your questions that you'd posed, and you have any follow-up or additional points you want us to make on those, then please do shout. So the third of the 4 learnings from the survey in this section was how we access healthcare services will change. Again, I think this is something that has been around and spoken about for a while. What has become apparent is that there has now been a forced need to embrace it at a greater level of pace and change in the housing sector. But what was very interesting and notable actually in this section versus some of the other sections that the circa over 120 people responded to, there was more of a mix of views about where the change would be. So for example, a number felt that monitoring vital signs was going to be a priority for them to try and roll out with selective residents over a period of time. Others felt it wasn't a priority. One of the things that there was a relatively universal alignment around was that assisting with prescriptions was a lower priority. We were surprised by that one. Actually, we thought setting up and engaging with more online pharmacy services might be something that would have given more peace of mind. But I think there's a dividing line about where housing providers and where friends, family, social services should operate, that is still quite blurred. And it'll be very interesting to hear your thoughts, not necessarily as a question, but as an observation about whether you feel that line has moved slightly, and whether you think that's a good thing or a bad thing, or just an inevitable trend. Certainly, it was notable from the survey, 78% of housing providers felt enabling residents to communicate with healthcare professionals had become a high priority, and that monitoring vital signs and prescriptions were an area where there was mixed views around. So we were very interested with the questions that were posed in the pre-questions. How can COVID learning accelerate a beneficial partnership? And I think, Mark, this relates to a beneficial partnership between, and almost as the second question illustrates, between health, housing and TECS suppliers.
Yeah, and I think we've already touched on it earlier on, but this is, I talked about cloud services and the ability to distribute across any geography. Well, it's about distributing it across any geography and across different service sectors as well. So where we have health and where we have housing, you know, they need access to the same data. And we've proved that certainly throughout COVID. I think the other thing that's been really interesting is more thinking about how people interact with the technology. And by that I mean, so we've got video technology and we think about door entries, we think about maybe mobile consultations. But actually, one of the things that we found during COVID was an example of things like video bingo, where everybody from one or two sets of accommodation could log on to one central point and they could play bingo together virtually. And I think it's things like that COVID has brought out, that there's other ways to utilize the same technology to provide a lot more benefit.
And specifically in terms of collaboration between health, housing and TECS, what do you think the way forward looks like?
I think the way forward there is for suppliers to be able to include a wider range of services within our conversation. So if I'm talking to adult social care about something, quite possibly the CCG, local CCG, have got the same issues, and we need to start bringing these departments and these services together and explaining them how the technology applies to individuals and what the benefit is for these people.
There are some really basic examples of access to health professionals which are available currently. So GP consultation via video apps, Livy being one, Babylon Health being another, Dr. Link being a third. There are a number of them. They're relatively commonly available. What do you think is going to be the trend? They're easily downloadable onto Android or Apple devices. It's clearly going to be a growth area. Do you think it will stop there, or do you think there's growth beyond that?
No, I think there's growth beyond that, and we're going to see this coming out of COVID now, where we've got the learnings and the understandings of what's happened during COVID, and now it's a time where the technology is going to move, and it's going to possibly accelerate to start expanding what we can actually do in terms of apps, and also how far these apps touch people. So what we focused on primarily is talking about professional services. What we might have to consider is informal services, so how we touch families and friends, and we bring them into the sphere of care as well.
And I think that's absolutely right, and leads beautifully into that fourth point, which came out very clearly in the survey, that more services that housing providers want to offer and want their residents to have access to are going to be online. They're going to need to be online, and that has a number of opportunities, but it also has a number of challenges. So it was probably the strongest level of approval of any of the survey questions, with 97% of housing providers feeling that the use of technology to communicate with residents will increase. And we already know that access to the internet is not as prolific as it could be, as it will be, amongst those who are in most of the social housing, certainly the retirement social housing provision. So that creates both a challenge and an opportunity. On the left-hand side, some of the points that were clear to us from the report were that with more services moving online, we need to make sure that everyone, as much as possible, has access, and access is in two forms, don't forget. The first part is a physical device, and the second part is the access to the internet. So whether that's via Wi-Fi, whether that's via fixed broadband, whether that's via a mobile device or otherwise. So the physical device and the actual connectivity are the two components that are required. And without doubt, COVID has highlighted just how important speed of communication is, and online is, by far and away the fastest way. There was a tremendous quote from one of the respondents about how no sooner had they finished printing letters to get through the doors of residents that the communication or the government guidance had changed, and that they wanted to deploy different information. There was the whole cost and time delay in that, which I think is a really clear illustration of just why online has a powerful part to play, provided we can get as many people as possible online. Questions that were posed in advance: what savings can be identified? How about having the right kit in place? Is it about savings, or is it about value-added service? Mark, I know you've got strong views on this.
I do, yeah, and definitely it's about both. So it's a better use of people's time. So caregivers have got more time, remote working, less travel, and things like, in the most basic form, analog systems. When they put a call onto a monitoring centre, there's a cost of a telephone call every time alarm call is raised. And somebody, local authority, housing association, have to pay that bill. On a digital system, everything's voice over IP, so it's effectively a free call. And it's about being able to... That's
if it's a genuinely digital as opposed to a hybrid. That's remember.
Yes. That's if it's 100% end-to-end digital and it supports voice over IP.
Yeah.
So it's being able to take those savings and reinvest those savings for the value-added services. I've already talked about analog door entry systems and moving through to a video system, and communications piece. So you hit the nail on the head. So we know that housing providers throughout COVID have been printing letters and posting them to their customers, and pretty much straight away something changes. Digital tech allows us to send the messages to a resident's room unit, and the key here is it's a room unit that they're familiar with, something they use every day. It's an interface they understand, but it's the conduit for us to be able to update the people and give them the details without them having to worry about the tech, without them having to go and learn something else or buy something else. I think that's really important.
The second question is one that I'm sure a lot of people on this call have been wrestling with, which is, how do you provide the most vulnerable, and not just the most vulnerable, but those who would benefit the most from access to online services? How do you do that?
Yeah, in its most basic form, it's shared access to computers, cheaper tablets. The problem that we've got with all of this kind of access is the usability. So it's somebody who's not really familiar with tech, trying to use this tech. If you look at something like a digital room unit, it's got a familiar interface. It's something that somebody uses every day, something they've had some great training on, and it's something they're comfortable with. And I think that's really, really important. If we've got something we're comfortable with, we're happy to interact with, then that gives us the usability. So what you do is you use that piece of equipment, that room unit, and do things like create a Wi-Fi hotspot from the room unit, and allow the room unit to connect to Bluetooth, so that people can have their own devices and connect to this room unit. And again, if it's their own devices that they're familiar with, they're much more likely to use it to be able to access the services.
Yeah. And last question that was posed in this section was around what new delivery models are at market or are available in the market?
That's a huge one, so I'm going to try and be quick. It's two pieces to the delivery models, I think. Improving the levels of integrated healthcare. So I've already mentioned it, involving CCGs, adult social care, with the same conversations, so that we understand what we're all trying to do, and we start integrating the healthcare records, the healthcare provision, and we understand the requirements across the board. Things like step up, step down care delivery. Somebody has telehealth, it disappears, nothing comes behind it. We've got to integrate this and keep it together. And the other piece to that is the funding models. So traditionally we're in a very kind of CapEx funded world, where we've now really got to think about how we fund these models. So thinking about rental models. So rental models where equipment is regularly updated in terms of software and in terms of functionality, so we can actually keep up with the technology. I mentioned earlier on that I think there's going to be an exponential growth in technology in this area, and what we need to do is make sure that the equipment that people are using is up to date to be able to manage the technology.
Absolutely. Okay, we've covered quite a lot of ground and got quite a lot of questions as a result. Before we move on to Q&A, I just want to plug our next enabling better living experience report, which has been published a couple of days ago, and we've got a live webinar just exactly like this one, but with new content based on the outcomes of that report, which is on Thursday the 8th of October, and you can find the details either via the Housing Lin or via our own website. So let's move on, probably, I think, now to the questions, because they've certainly been coming in. I don't know whether that is going to give us real food for thought, or whether actually we're going to end up with more questions, not that we can answer, but whether the questions are bigger than the content we've got for today. So let's try and put our best thinking brains to those that have been raised. So Ian, do you want to start reading them out for us?
Yeah, sure. So the first question that we've had is, in the report you recommend creating digital advocates. How do you recommend going about doing this?
So that is definitely top down and bottom up. So that the organizations that we've seen be most successful are those where, from the board on down, there is a real belief in the power of digital to transform the living experience. And at a practical level, there are people within a community, within a whether it's a scheme, a retirement block, or whether it's a local area, there are people who are generally more impassioned, more enthusiastic, and are therefore more likely, more willing, and more able to be able to encourage those who are less competent or less familiar with whatever is being adopted. I think in most walks of life, it doesn't matter what it will be, we always see a different pace of adoption, but finding those who are enthusiastic and immediately see the benefits, and encouraging them to extol to their fellow residents has been something we've seen be really powerful. Ian, I know you've done quite a bit of work on advocacy with some of our customers. What else would you add to that?
I would say, I think one of the things that we've done is providing the advocates with the tools to be able to kind of share the message. So it's been, you know, we've created what's called our knowledge base, and we have a whole host of materials and videos on there which has supported that initial training process. But it's been a useful tool for as a new resident comes into the development way after the actual initial installation. There's that whole host of materials to be able to train that person up as well. And to add to that, I think one of the things that we've done as an organisation, which has been positive, is we've listened to our customers. So, you know, we're learning as well, and there's been times where one of the things I can think of is a resident that came to us with a little card that they had made with regards to reminding people in their development to use the I'm OK functionality. And it was a great idea, not something we had thought of ourselves. So we took that on board, and we created that, and that's now a resource again that other developments can use. So it's all about learnings from both ourselves and residents.
Really good point. Really good point. Next question.
What has been the feedback from residents on using video?
Fantastic. We've shared, and we've got some really nice stats actually from other work we've done. The customer satisfaction feedback from, I think it's about 1,000, was it 1,000, Ian, end residents in total that we surveyed? And not surprisingly, circa 90% or so felt having a modern touchscreen device as opposed to a traditional Telecare device made them feel less stigmatized. They felt the speed of a digital system made them feel a lot safer. But I think the stat we loved most was that 1 out of 2 felt their well-being had improved because of the ability to communicate with other residents in the apartment. And that was a pre-COVID survey. So it would be very interesting to run that again, because I think the numbers would be even higher. But 1 out of 2 residents saying slightly more than 1 out of 2 residents saying they felt their well-being had improved because of the ability to communicate via video with other residents. Really, to us, was a powerful endorsement of just what a difference video can make. Ian, next question.
Yeah, the next questions. I think this is possibly touching on the fact of the work from home situation, and it's do you think the video is the long-term replacement for site staff?
Or Mark, I'll get you to offer a view on this in a moment, but I'll just offer my own view first up, which is I think our industry, our sector, responds best to a blend of empathetic, caring people who are supported by really powerful technology, and technology in a non-intrusive, informative, insight-generating fashion. And I, personally, I think those people can do a much better job with more insight. The example we use quite often is that if a housing manager or a development manager, whatever language you use in your particular organization, has the insight of how much activity there's been during the weekend or overnight, if they have that in a dashboard, if they have those insights to hand, if they know which devices are low battery, if they know where there have been particular, and we're expanding this out now into some of the other devices which you can report on, whether boilers are working, whether heating systems are working, all of those things mean that rather than replacing the housing manager, they mean the housing manager can do a much more effective job by concentrating on those people who really need the service and less on spreading themselves thinly across everybody equally. One of our customers has an absolutely fantastic motto, which is about being absent until needed. And I think the more insight and intelligence you provide, and the more tools you offer in terms of engagement, then the more that opportunity is to focus on when they really are needed and less on a generic broad brush approach. Mark, I know I've probably stolen quite a bit of your thunder on that, but was there any more you wanted to add?
Completely. So it's about a couple of things, as you've already said. It's the technology is about being complementary in terms of the delivery of the care, and it's about allowing us to deliver more appropriate care. So the technology can take care of some things, which allows us to focus on the care delivery from people to people.
Yeah, I think that's absolutely right. And I'll give one further example which extends slightly beyond housing. We know that many people within sheltered housing, within supported housing, have care needs. What typically happens is that they will have a breakfast, they'll have a lunch, they'll have a dinner, and they'll have a bedtime, and they'll have a dom care 15-30 minute visit for each of those. There will be little or no insight when the caregiver arrives as to what that resident has experienced over the preceding hours since their last visit. They may well have been up 4 hours in the night watching television because they have not amnesia, they have dementia. They put themselves to bed at 7 o'clock, having just had a large warm milky coffee, and the caregiver tries to wake them up at 8 o'clock, reports they're not responsive, they don't want to eat anything. You know, that there is a great deal that people can do with greater insights, and as Mark said, it's about complementary rather than about replacement. Ian, next question, please.
Yes, we have 3 questions left. So just a reminder, if you did want to ask your questions, to use the Q&A functionality at the bottom. So the next one is, how do Appello provide access to resident data remotely?
Mark, do you want to describe the single breast record?
Yeah, so we have a back office product called SBR, Single Breast Record, which actually allows us to not only provide access to the data, but to collate data from different data sets. And that's really the key. So if I need data from my monitoring center, if I need data from my Fitbit, if I need data from my telehealth application, it's actually putting that data into one place in a cloud-based delivery, in a secure delivery, and in a one single straightforward user interface. And that's really the key thing. One set of training, how do I access that data? And it all comes from different data points.
It can be used for something as basic as updating a resident record directly into the monitoring center, and it can be used at the more sophisticated end, as Mark referred to, as a proper well-being index if the right devices are in place. So it is a very powerful tool. It's based on a Microsoft Dynamics platform that we've written our own code and IPR across the top of. So very happy to have any discussions about that for those who'd like a follow-up. Ian.
Yeah, I'm going to reorganize the questions because another one's just come in related to that. So it's you have mentioned SBR a fair bit. Is this part of Smart Living Solutions?
It is a capability within the Appello cloud environment. It applies to both monitoring customers and can apply to Smart Living Solutions as well. So hopefully the previous answer we gave expanded on that sufficiently. But yes, it can be part of, but it's not dedicated to Smart Living Solutions. It is available to our monitoring customers as well, for them to be able to provide their house managers with the access to resident data immediately, as well as updating it, changing it, amending it, seeing what overnight events there had been.
So that answers the next question, which has just come in once again, which is, so are you saying I can update my own resident details on SBR?
Correct. That's exactly right.
So our next question is,
and by the way, and not just update them, but you can see for within the hierarchy that you're entitled to. So an individual might be a single site manager and therefore they would just have access to that site, or they might be a regional manager and therefore they would have access to a dozen sites or whatever the number was within their remit. You'd be able to see not just and update the resident data, but you'd also be able to pull stats and data on number of calls, amount of overnight activity, a number of different insights which would help understand when you arrive at work first thing on a Monday morning, rather than having to phone the monitoring centre and get details, you can see all of them instantly reported in neat graphical formats. Hopefully that answered the question thoroughly. Ian?
Next question is, do Appello provide Wi-Fi for free?
No. We provide Wi-Fi well, actually, there is a room unit that has Wi-Fi hotspot capability for free, but it is a premium unit. It's part of the wider range of options within Smart Living Solutions, but it's not for free. It is bloody good. It is bloody good though.
And the next one is there a limit of sites that I can be linked to and call into remotely?
No. I mean, Mark, unless I'm missing it, no.
No, you're absolutely right. So the sites are managed through the cloud services, and whatever we construct in the cloud service will allow you to manage and call into.
Again, it's back to that creation of a hierarchy. So we don't allow anybody to have access to everything. We create a hierarchy based on what our customers tell us the permissions of a particular individual should allow.
Great stuff. And we have one last question. So just a reminder, if you do want to ask a question, use the Q&A functionality at the bottom. And the last question is, how could we run a trial of a video GP service with you? So I think that is a recommendation within the actual initial report. So it's based on that question.
Yeah, so there are a number of different GP apps which are available. The starting point is to understand which your local GPs support. So I think Livy is one of the most widely supported, Dr. Link, Babylon Health, but there are a number of other ones. So get in touch with us and we'll work with whatever your particular region is and see what's possible.
Great. Well, that's the end of the questions. Oh, actually, one second. Don't go anywhere.
You can tell this is live, people. Well, as if Mark and I's shambolic interactions didn't already give you a big enough clue around that.
So the question is, so we appreciate that this webinar seems to be more aimed at schemes, but what solutions do you have for individual residents?
Okay, great question. And one of the reports which is coming out based on the survey is dedicated less to specifically to housing and more to generic care in the community. But yes, in terms of solutions, a number of the capabilities that we've described, so being able to, for example, update records remotely, having access to records remotely, having devices which can provide a level of interaction or insight, those are all feasible in a non-scheme based environment, depending on what type of solution and experience you're looking to customize for your residents, so or end customers. So if you get in touch separately, my email address is tim.barclay@apello.co.uk, or you've got Ian's email address because of the registration details. Get in touch with either of us and we'll outline the breadth of opportunity that's available. And the same applies to anybody. We hope you've found this useful. I can see from the number of people who've stayed with it all the way through that you definitely found it of value. We really do appreciate your time. We hope there were insights in there which you will be able to think more widely about within your organizations. We, of course, are delighted to follow up on anything that's related to ourselves or around the wider themes that we've talked about. And look out for the new content, which will be on the October webinar and November webinars. And in the meantime, thank you very, very much for taking the time. Thanks very much for listening, for your participation, for your questions. It's great to see how many of you from the polling question have found it useful, and we look forward to any follow-up that will be of value. With that, I think we'll close, and thank you again.